analyze the resource requirements. So you want to know what are the resources available, and based on that, you're going to decide how to triage your patients. Because, for example, if the patient comes in and he has burn injury, and you don't have a burn unit or burn specialist, then you're going to redirect him to go to a specialized hospital that has burn facilities. Establishes national benchmark. So you want to know what is the time to see this patient, what is the expected waiting time, and these are the benchmarks that you're going to follow based on your triage. So what are the determinants of triage acuity? So how would you know if this patient is sick when you're doing a brief assessment in the emergency triage? What are the things you're going to look for? So write it in the comment or chat section. Vital signs, excellent. So vital signs is one of the most important things to do in the triage. What else other than the vital signs? History, okay, excellent. So in the triage process, we don't take a full history, we take a brief history or just the chief complaint. Yes, the chief complaint is one of the important things. A patient coming in with severe chest pain as a chief complaint is different from a patient coming in with a finger pain for 6 months. This is very important in terms of triaging patients in the emergency department. ABCD assessment, brief physical. Yes, all of these things will be very helpful in the triage process. So the chief complaint is one of the crucial things to ask for. Brief triage history, injury or illness, signs and symptoms, again, briefly. General appearance of the patient, is he unconscious? Is he conscious and sitting comfortably? Vital signs, as we said, brief physical appraisal or brief physical examination in triage. And that's it as your triage determinants. So the triage role is basically to determine the severity of illness or injury for each patient who enters the emergency department. So every single patient will need to be triaged before entering the emergency department. Effective triage is based on the knowledge, skills, and attitude of the triage staff. So this needs someone to get trained for that. He needs the knowledge, he needs to read about the triage process, he needs the skill and attitude to be trained well and how to deal with those patients. So it needs expertise and training to be able to triage patients. And triage usually gets done by nurses and also physicians in the emergency department. Triage process. Assessing and determining the severity of acuity of the presenting problem, which I've mentioned before. Process the patient into a triage level. So because you're triaging a patient, you're gonna have to make a decision about what level of triage this patient will be labeled or decided to be. Determine and direct the patient to the appropriate treatment areas. So most emergency departments, they have different treatment areas. They have the resuscitation room, they have the acute care area, they have the fast track area, they have the OB-GYN area. So you have to determine and direct those patients to the appropriate treatment area. Effectively and efficiently assign appropriate human health resources. So health resources or human health resources, basically the nurses, the physicians, and you're gonna, if you're an emergency chief or chairman, you're going to have to decide about which area that needs to be staffed by more nurses or less nurses. By the way, if you have any questions while we're going through the presentation, feel free to write your question in the chat room section. So triaging, usually it's a 5-level triage. This is in the United States, Canada, UK, and Australia. Before, or at some countries, they have a 3-level triage process. But in most countries, it's a 5-level, level 1, 2, 3, 4, 5. And the sickest patients, which basically we call them the resuscitation patients, they are level 1. Level 2 is the emergency patient. Level 3, urgent cases or patients in urgency. Level 4, less urgency. Level 5, who are not patients who are not urgent or non-urgency. As a goal, for level 1, you want to see the patient immediately. You don't want them to wait at all. For level 2, you can wait. They can wait up to 15 minutes. For level 3, they can wait up to 30 minutes. For level 4, they can wait up to 60 minutes. And for level 5s, they can wait up to 2 hours. So this is basically a brief understanding of the expected time waiting. And that's why we're trying to triage and prioritize our patients to see the sickest patients first to avoid any complications or deterioration of those patients. Triage is a dynamic process. As I said, a patient who may come in to the emergency department, after 1 hour, he may deteriorate and he may get more sicker. So you have to be assess and do reassessments of those patients. And usually we do it every half an hour or every 1 hour. A patient's condition may improve or deteriorate during the wait for treatment. So a patient coming with chest pain, he may get worse, he may collapse, he may actually go into cardiac arrest while he's in the waiting area. A patient with chest pain also may improve and his chest pain completely resolves while he's in the waiting area. The CTAS triage system, or the Canadian Triage and Acuity scale, this is the most common triage that we use here in Saudi. So you're going to be familiar with that triage system. Again, as I said, 5 levels. Time to primary nurse or registered nurse assessment should be immediate for the level 1 and level 2. Level 3, less than 30 minutes. Level 4, less than 1 hour. Level 5, less than 1 hour, 2 hours. Time to MD assessment, this is what we have discussed. Meaning that level 1 patients who are in the registration room, we're putting them on a continuous monitor to check their vital signs continuously. So you can see on the screen here their vital signs check every second. Level 2, ideally you should reassess them every 15 minutes. Level 3, you should assess them every 30 minutes. Level 4, every 1 hour. Level 5, every 2 hours. This is the Emergency Severity Index, which is basically the triage system that's being done in the United States. So we've been through the Canadian triage system. This is the American or the US triage system. Again, it's a 5-level from 1, 2, 3, 4, 5. It's more simplified. You're going to ask questions in the algorithm, and based on their questions, you're going to decide about the level of that patient in terms of triage. The first question you're going to ask is, does this patient require immediate life-saving intervention? A patient coming with severe injury after a car accident and he's unconscious, yes, this patient will need an immediate life-saving intervention, then it's going to be a 1. If it's no, then the second question, is it a high-risk situation, or confused, lethargic, disoriented patient, or severe pain or distress? If that patient meets one of these criteria, then it is a category 2 or level 2 patient. For example, a patient who's coming seizing or after a seizure, and he's unconscious and confused, this patient will be a level 2 in terms of emergency. If it's no, then you're going to ask how many different resources are needed. What does that mean? Resources, does this patient needs to be, does he need a CT scan? Does he need to get blood labs, or does he need an X-ray? If he doesn't need anything, for example, a patient coming in with just a runny nose and just like cold symptoms, and he doesn't need any investigation, he doesn't need anything, and he doesn't need any medication, then he's a level 5. If the patient needs one investigation, for example, he needs an X-ray of the chest because he's coughing, otherwise he doesn't need anything, that's a level 4. If he needs many resources, that most of them will be level 3, but they should not be in the danger zones of vital signs. For example, if the patient's heart rate or vital signs are abnormal, then they're going to put him in level 2. You cannot put them in level 3 if they're in the danger zone of vital signs. Okay. This, by the way, applies to adults and pediatrics in terms of the triage process. So these are examples of the levels or categories of level 1, level 2, level 3, level 4, level 5. So you can see here level 1, code or arrest or cardiac arrest, major trauma, shock states, near-death asthma. This is in level 1. Level 2 examples, head injury, severe asthma, overdose, vomiting and diarrhea with suspicious of dehydration. Level 3, head injury, alert and vomiting, moderate trauma, GI bleed with normal vital signs, vaginal bleed with normal vital signs. You're going to notice that most of the patients with abnormal vital signs will be in category 1 or category 2 as a rule. And level 4 or less urgent categories, head injury with no vomiting or no an alert, which is basically minor head injury or minor trauma, earache, allergic reaction, minor or just skin rash. Level 5 or non-urgent cases, patients with very minor trauma, not necessarily acute, meaning that the patient had a trauma 1 month ago, sore throat, no respiratory symptoms, diarrhea alone, no dehydration, normal vital signs. All these things or all these categories will be part of the level 5 patients. In terms of diagnosis, you can find it also here. For example, level 1, traumatic shock, pneumothorax, traumatic intention. Level 3 here in terms of diagnosis, pyelonephritis, asthma without status asthmaticus, GI bleed with no complication. In level 5, upper respiratory tract infection, vomiting, gastroenteritis, dressing changes, all of these in level 5. So we're going to go through them one by one. Level 1, resuscitative interventions. Conditions that are threats to life or to limb. So it's not only life, also limb, meaning that the patient has severe lower limb or leg ischemia. This is considered a level 1 because if you don't save the limbs, eventually the patient may lose his limbs and he will not be able to save his leg or his arm. Or imminent risk of deterioration requiring aggressive intervention. So those are the patients who need resuscitative intervention. Usual presentation, as we said, code and arrest, major trauma, shock states, severe respiratory distress, altered level of consciousness, seizure and status epilepticus, traumatic shock, acute myocardial infarction with complications, major head trauma. We're going to talk about the appendicitis and each of these, and this is something that you have to think about. Appendicitis, do you think it's a level 1? Appendicitis is a diagnosis. No patient will come to the emergency and tell you that I have appendicitis. They will come and tell you that I have abdominal pain, and then they're going to have to figure out what's the diagnosis. So usually it's an abdominal pain presentation. Appendicitis, it's a progressive disease. That's why I'm saying triage is a dynamic process. You may present with appendicitis with just small minor abdominal pain, and then after 2 days or 3 days, this appendicitis will get worse and gets complicated into perforated appendix, and then you may go into sepsis and sepsis and septic shock. So appendicitis might present as level 3 because of abdominal pain, and may go into level 1 with septic shock with complications of perforated appendix and worsening appendicitis. So again, this is a dynamic process. Someone with the same diagnosis may come at level 3 or at level 1. So it depends on the vital signs, it depends on the chief complaint, it depends on the factors that we have mentioned earlier. Level 2, conditions that are potential threats of life or limb or function that requires rapid medical intervention or delegated acts. So what are the possible level 2 emergent presentations? We've been through them briefly. So what are the possibilities? So again, presentations, not a diagnosis. Abnormal vital signs. So chest pain, such as MI, diarrhea I would add with dehydration or abnormal vital signs. Trauma, stroke, altered level of consciousness, acute myocardial infarction, severe asthma, stridor, acute psychotic episode with agitation. So those were the level 2. So what about level 3? What are some of the example presentations? Fractures, okay. Severe headache, okay. GI bleed. Abdominal pain, yes. So those are one of the common things that presents with level 3 triage. Conditions that could potentially progress to serious problem. They are not serious yet, but could potentially progress to a serious problem and will require an emergency intervention. And it might be associated with significant discomfort or affecting ability to function at work or activity of daily living. Usual presentations, renal colic or biliary colic or flank pain, GI bleed with normal vital signs. Keep in mind that if you have abnormal vital signs, you're going to be either 1 or 2, not 3. Previous seizure, but now is alert. Dehydration with no abnormal vital signs. Vital signs, I would say just if it's a very, very minimal change. Like for example, a heart rate which is a bit slightly tachycardic, like 105 or 110. Moderate risk of harm to self or others, such as psychiatric patients who are thinking about suicide or injuring other people. Inconsolable infant or infant not feeding. This applies to pediatrics. Behavior change. Level 4, conditions that relate to the patient's age, distress, or potential for deterioration or complications would benefit from intervention or reassurance within 2 hours. So it's not that serious. Usual presentation, upper respiratory tract infection, earache, chronic abdominal pain, chronic meaning like abdominal pain for 1 month or 2 months, urinary tract infection, vital signs normal, and so on. One thing to mention, sometimes it is difficult to differentiate between 2 levels together, meaning that some patients may get triaged as level 4 or level 3. But level 4 will not be triaged as level 1 or level 2. Usually there's going to be one level below or above, depending on the assessment of the triage staff. Level 5, non-urgent conditions, conditions that may be acute but non-urgent, as well as conditions which might be part of a chronic problem with or without evidence of deterioration. The investigation or intervention could be delayed or even referred to other areas of the hospital or healthcare system. So level 5, some of them actually can go to the clinic. So the patient comes in with abdominal pain for 2 months, you may not need to see him in the emergency. You can say, you know what, just go get an appointment and see a physician in the internal medicine clinic or family medicine clinic to assess you, okay? What level you consider hypersensitivity? Hypersensitivity, I would assume that you mean allergic reaction. Again, allergic reaction can be just a minor itchiness, حكة بسيطة, or it might be severe anaphylactic shock in which the patient is hypotensive and unconscious. So this is, again, depending on the severity of the allergic reaction. It could be level 1 up to level 4, but usually it's an acute. It won't be level 5. It's between level 1 up to level 4. Usual presentation. Yes, so the triage, it gets done by the nursing team most of the time, but the physicians or the doctors also, they get involved in triage. So it could be done by either one, but most of the time, it's the nursing team will do it. Strains, basically ankle injuries is the common strains of level 5. Sprains, single episode of vomiting, sore throat, prescription refills, a patient coming who just needs to refill his prescription. He's telling you that I have diabetes, I will lose my medication, I need my medication to be refilled. This is also applies or will be categorized in level 5. Chronic problems with no change, meaning abdominal pain for 3 months and no change recently. They did not get worse for the past few days. Okay, pediatric triage system. So it's the same concept, it's the same idea. And there are 3 things that must be assessed and documented on all pediatric patients, which are different from the adults, or I would say additional compared to adults. Did you guys do your pediatric rotation or pediatric block? If you have done it, what do you, okay. So go ahead with the question. Oh, this is this semester, so you did not do it yet. So what are the things that you would look for in a pediatric patient in the triage process? Probably 2 or 3 things that you have to check. Do you guys know? Heart rate, it is part of the vital signs, but you're going to have to check something else. Breathing, okay. So it is actually the work of breathing. So technically it is not a vital signs, but you have to check the work of breathing. Is he in distress? Is he breathing easily? Is he breathing with difficulty? And this usually applies to pediatric patients in terms of assessing their condition. Respiratory rate, it's part of the vital signs. Heart rate is part of the vital signs. Cap refill is something that you have to check in those patients. Cap refill is basically you're going to have to touch the tip of the finger and squeeze it for a few seconds and then let go and then see how fast the tip of the finger gets refilled with blood. Usually, normally, it should be less than 2 seconds if you want to check the capillary refill. So capillary refill, heart rate, and respiratory rate, and the work of breathing are very important in assessing the pediatric patients. Again, we're using the Canadian Pediatric Triage Acuity scale. It's the same concept. Keep in mind that the vital signs for pediatrics depends on the age. So the respiratory rate, heart rate, blood pressure, you have to match it to the appropriate age, okay? So, as we said, vital signs must include the heart rate, blood pressure, resp rate, O2 saturation, temperature, capillary refill, and also accurate weight. Because many things in pediatrics depends on the weight. If you're going to give them medication, you're going to have to base that medication dose on the child weight, okay? So the vital signs, this is very important. Make sure that you remember them. Heart rate, blood pressure, respiratory rate, and O2 saturation and temperature. Capillary refill and weight and accurate weight, this applies to pediatric patients. Vital signs are your safety net. Make sure you do it on every single patient in triage. Less urgent and non-urgent patients have normal vital signs. So you cannot categorize a patient as level 4 or level 5 while he has abnormal vital signs. Abnormal vital signs are at least an urgent or at least level 3. Okay? So if you get a case and the patient has vital signs, it's never level 4 or level 5. It's either 1 or 2 or 3. Again, another reminder, triage is a dynamic process. A patient can deteriorate or improve at any moment. So that's why you're going to have to reassess the patient while he's in the waiting area. Okay, I think that's pretty much it for triage and the introduction for emergency medicine. We can take some questions quickly for the next 5 minutes. You can write your questions in the chat group, and we're going to answer one by one. Any questions? After that, we're going to go for a break for 15 minutes. Any questions? Okay, good. الله يعافيك.
دكتور معلش عندي سؤال اذا مسموح اني اتكلم.
Go ahead.
اذا جاني بيشنت دكتور في الامرجنسي وكان انكونشس، انا ما اعرف هل هو ديكي اي، هل هو مثلا هارت فيلير، هل هو اورجان فيلير او اني ثينج. الريسسيكيشن اللي يعني تسوونه اي بي سي وبعدين تسوونه البلد وورك والاشياء الثانيه.
Yes, so any patient who needs resuscitation, you're going to have to resuscitate him based on the current situation. The blood work will take at least 20 minutes, 10 minutes at least, depending on the type of blood work. And the blood work usually doesn't help you in the resuscitation at the beginning. You're going to have to go with the A, B, C, D. And then based on that, you're going to give the treatment that the patient needs. So you should not wait for the blood work. You're going to have to treat the patients based on the other tests that you have at the clinical bedside: vital signs, ECG, quick chest X-ray. But the blood, it will take at least 10 minutes if you're going to do like the point of care blood gas. Okay, I think if anyone wants to ask a question, you can raise your hands, or you can write it in the group chat. You guys know how to raise your hands? I'm not sure if this feature is available. If you know the diagnosis, that would be good, but the diagnosis is important, but sometimes it will take time to find the diagnosis, okay? But in the emergency department, you're gonna have to find how sick is the patient and give him the treatment needed. Okay, excellent. So we're gonna take a break for 15 minutes.